Next document is a healthcare proxy. This is like a power of attorney, except instead of it applying to financial matters, remember the power of attorney applies to bank accounts, credit card debt, asset transfers, all kinds of financial matters, real estate. The healthcare proxy has to do with making medical decisions. Now, we have an interesting law in New York State. Anybody who's a competent adult over the age of 18 years old and who has their right mind is able to make their own medical decisions. So you talk to your doctor, the doctor makes a recommendation, and ultimately at the end of the day, you decide whether or not you want to accept that treatment. You don't want to do it, nobody can force you. If you do, you go ahead and have the procedure. If you're not competent, you can't make these decisions because you are suffering from dementia, and there are various levels of dementia. Many people with mild or middle stage dementia are able to make these decisions. Many are not. It really depends on the situation. And this is really a gray area. Lots of times, I'll forget where my car keys are. Does that mean I'm not competent? No. Maybe I'll forget somebody's phone number. So, this is really a gray area. But if it's determined that you're not capable of making your own decisions, and by the way, competency is not a politically correct term in New York State anymore. The correct term is capacity. So if you have capacity, you're able to make legal decisions. If you have diminished capacity, you may not be able to make these legal decisions, such as your health care. So the proper term is diminished capacity. So if you have diminished capacity and you don't have a health care proxy, okay, so you don't have legal capacity and you don't have a healthcare proxy, then I bet you've heard of the Terry Schiavo case from last year in Florida. Okay, so this is a perfect example of how this doesn't only apply to seniors or elders. This is an example of how you can be a perfectly healthy 25-year-old woman and have a heart condition and all of a sudden go into a coma for 13 or 14 years, and then your husband and your parents are fighting in court at a seven-figure legal fee, and you're in the newspapers, and they were just a regular old family. And the reason they were in the papers and the reason they spent all this money was because they didn't have a healthcare proxy or a living will. We'll get to a living will in a second. If she had a healthcare proxy, that whole thing could have been avoided. And you can't turn back the clock. God doesn't call you up and say, you know something, Jack? 2 weeks you're going to have a stroke, so you better get that healthcare proxy done. If you don't do it today, I can't promise you you're not going to be the next Terry Schiavo, because we currently have 5, and this is just in Westchester County. We have 5 Terry Schiavo cases where families are fighting. People, relatives are wasting away 60 pounds, 80 pounds, 40 pounds. One person's 40 pounds, okay? Wasting away, and the family is fighting over whether or not they should be kept alive or not. These aren't in the papers, okay? They all don't make the papers, but they're happening right here. And you can save your family this stress and this disgrace by simply having a written document called a healthcare proxy. You really don't even need to go to a lawyer. You can probably pick up one here. You can go to your doctor and get one. You get one at any hospital. All you need is 2 adults to be witnesses. Now, the adults can't be the family members who you select to make the decisions for you. So you want to pick somebody who's going to make medical decisions for you, and they're only going to make these decisions when you can't make them yourself. So you're not giving anything up. You talk to your doctor, you make the decision. The healthcare proxy only makes the decisions for you when you can't make them yourself. Now, the difference between a healthcare proxy and a power of attorney, or one of the differences, is they got to pick one person. They didn't want to put the medical profession or the healthcare providers in the position of having to talk to 2 people, and the son says, well, mom wouldn't want to live under these conditions, let's pull the plug, and the daughter says, no, mom wants to be kept alive, and the doctor doesn't know what to do. So they make you pick one person who is the spokesperson. Now, the family can have a meeting, they can talk together, they can all make the decision so that they all feel like they're on board and part of the process, but at the end of the day, there's got to be one agent, one spokesperson who's going to communicate your wishes to the doctor or to whoever is providing the health care to you. Without a health care proxy in New York State, and a relative does not have the authority to make non-routine, non-emergency medical decisions for you. We are one of a couple of states in the country that does not have surrogate decision making. Surrogate decision-making means, remember I said that if you die without a will, New York State will make a will for you. They'll tell you who's going to get your property. Well, if you get sick without a healthcare proxy, we don't have a law that says, okay, if you don't have a healthcare proxy, then your wife makes a decision, and then your kids, and then your nephews, and then your uncle. We don't have one of those statutes. Our statute says if you don't have a healthcare proxy, then your family has to go to court to make these medical decisions for you. Again, this is very expensive, and it's time-consuming, and it's invasion of privacy. For the last 10 years or so, we have had a bill proposed in the New York State legislature which would have passed surrogate decision-making authority, so it would have allowed your loved ones to make decisions for you without a healthcare proxy. Now, even if that passes, you may not like the statute. You may not like who they pick. But it hasn't passed for the following reason. There's been opposition from several of the special interest groups. One of them happens to be the same-sex marriage group. They're saying, well, if you're going to give a wife the right to make a medical decision for a husband, then a same-sex partner ought to have the right to make a medical decision for a same-sex partner. And that has been holding it up because they have not been able to push that through the New York State legislature. There are a couple other special interest groups that are also holding it up, and they won't just pass the statute as it is and then deal with these other issues later on. They want to pass what they think is a complete bill so that they include everybody. So, I mean, I'm not going to get into the political issue of the same-sex marriage, but that's what's holding this up in New York State. So until we have that, you can't make medical decisions for loved ones, non-routine, non-emergency medical decisions, without this healthcare proxy.